to a lot of services. You will find, though, on your Flow sites or your Canvas sites that you will immediately have access to quite a lot of areas. So there is never a lack of help available for you. And I'll briefly go through some of those. And I can see that Tori's written. So the people who have just arrived, who might have missed the first bit, Level 2 at this particular campus is where you go for help with your enrolment, any study inquiries. There's an international student advisor, so I see a lot more people came into the room. If you don't mind, if you're an international student, could you put your hand up so I know who I'll be addressing a bit later? Yep, okay, cool, great, awesome. There's the FUSA, the Flinders University Student Association. Also, I'll talk a little bit about them later. So you've got all these links to assist you, all right? So I know that up at our big campus, has everyone been up to Bedford campus? Yeah, no, that's okay. So, you know, we have a lot of all this up there. So when the Flinders City campus started, we wanted to make sure that you guys also had that same assistance. Sometimes it might be virtual as they're building the support services here, but there would definitely be help for you. So, and if there isn't, you reach out to someone who will be able to direct you to help. Okay, there should never be a point when you have got no one to help you. So my talk today is going to include lots of stuff. Some of it may seem very boring, but it's still important stuff you need to know. I'll talk a little bit about nursing, and then I'll talk about some support services later. Student administration, you might, when you talk to the student admin enrolment people, they might talk about bundles. So you guys here are not as impacted because you're the FCC, so Flinders City Campus, FCC cohort. So you have a specific bundle, which I think I've got a slide. These are bundles, all right? So what we do with the bundles, or the enrolment people do with bundles, is they make sure that it doesn't clash with your placements, all right? We make sure that when you're on placement, come in and find a seat wherever you can. There's some up the back here. We make sure that you are not doing a topic while you're on placement. You're also not allowed to work while you're on placement, hence you're not supposed to do topics while you're on placement. So they make sure that there's no clashes there. They make sure you're not doing a class at the same time. You know, you don't want to be doing A&P while you're supposed to be doing another class at the same time. So they have a look at things like that. Sometimes students will contact me to overrule or approve another bundle. And I can't always do that. Okay, and I don't like to do that because they sort the bundles out with your pathways and your topics so that they don't clash. All right, so if I do have to approve it, it would have to be for extenuating circumstances. But they're the contact numbers that you call, so you can find there's key dates that you will need to be aware of. I think they will come up on screen shortly. But it's really ideal to enrol in your topics for the full year. Okay. The reason around things like that is that, you know, we do classes at set times. I don't know how many classes might be offered here at FCC, but there might be an 8 o'clock class, there might be an 11 o'clock class, there might be a 2 o'clock class. So if you're not a morning person, then you need to make sure you pick that 11 o'clock or that 2 o'clock class. So you need to get in fast to get into your classes, because once they fill up, I can't make space available. All right? So it's ideal to book your classes for the whole year, and that way you know what you're doing. You know when you can book your holidays. You know when you shouldn't be booking holidays. All right? And there's always someone available via the Ask Flinders if you've got queries about your enrolment. So back to your bundles. This is just what it looks like across the year. Okay, so this is across your whole year. A, simply not to confuse you, just means it's in person, all right? So FCC, you're mostly in person here. So in first semester, you've got those first 4 topics that are 12 weeks, like a normal semester. That's the only time you'll see that in nursing. I don't know why, we start you out really gently with 4 topics once a week per topic, and then you get into your 6-week topics. All right, so your 6-week topics, that's when you start coming to class twice a week for 3-hour sessions. And they're pretty intense. That's why they're called intense topics. So that's when you really need to knuckle down, okay? Because we basically do that 12 weeks in 6 weeks. And then, as you'll see, there are options for, and like I said, the 2 bundles. So many of you might be split into 2 bundles potentially. Whilst it looks like there's lots and lots of placements there, you'll be put specifically in a placement area. because of the placements available. All right, so you're not actually doing a 6-week placement for first year, you're doing a 2-week placement. All right, so we can talk more. Does anyone have questions about that, since I do have an expert in the room? Anyone got questions about enrolments, bundles, classes?
Is there a deadline to register for classes, or can we do it throughout the year?
Deadline is, you can go.
The last date to enrol for nursing is normally the first day of teaching. So you want to have it all finalised before that first day of teaching for each topic.
Yeah, so Monday is first day of teaching for the first year topics. You need to be enrolled in your class by then. Yeah, that's why I'm saying it's good to enrol in advance. You know what topics you're going to be doing. Pick your classes, pick it around your sporting events, your weddings you have to go to, all that sort of stuff. You know where they are, pick the classes that you need. That's Courtney at the back. She's the manager of our SAS team. Thanks for being here today, Courtney. All right, let's see what else I've got to talk about. Oh, is there any Ians in the room? I don't know if we've got any second years here. Is there any second years here? Yep. Ians? Yes? Okay, well, I will talk about it then, because you guys are important too. So we also have, apart from the 3-year degree, we have a degree for, we call it the UC, the BNG UC, which is the BNGU with credits because they're enrolled nurses. So they have a different pathway. It's 2 years. So I've just put this up in these slides because I always appreciate that we do have some students in that pathway. So yours is a little bit different. You only do one first year topic and then you go straight into your second year topics because we've given you credit for your prior studies and experience as an enrolled nurse. And as you can see, for those 3-year degree, your first years, they go straight into these 6-week topics. Okay, we don't have anything over or under a placement. When you're doing your placement, that is what you're doing alone. There are no topics around, there are no topics at the same time, and no working at the same time, which Jodie will reiterate as well. So that's what our ENs do, so they get a 2-year bundle. Now, let's talk about some nursing stuff. What's today's? Are we all excited and overwhelmed and overstimulated with starting uni next week? Yes, we are. It's very exciting though. I see there's lots of young people in the room. Lots of different ages do nursing. I'm just doing a quick scan. But yes, you're all looking young. That's great. So it is overwhelming to start out with, so make sure that you look around you and have a look at your networks and make sure that you do things like come to class, which I'll probably badger on about as we go along, to make those connections, because it does make it a lot easier. I know Tori talked about making sure that you network and how much easier it is if you do university with a friend or a colleague, or you'll find your new best friend or best friend for life might be in this room studying nursing with you. So it is overwhelming to start with, but this is the time for you guys to, start learning, start asking questions, all right? Don't be shy. And you know what? If you are shy and you don't want to ask questions in a classroom, make sure that you do things like email the tutor. Email the tutor or your topic coordinator who will give you the correct answer. It's really important. It's a time for you now really to realise all these little things that you're going to be learning, that I'm going to talk about probably on the next slide, are all going to impact someone's life. And when you start thinking about that, it's like, wow, I'm going to be really accountable for this. And you will be. And I'm telling you, this is such an exciting career. Doing nursing will open up so many doors for you. And I do meet a lot of students, and usually if I'm teaching a first year class, I usually go around the room and I'm like, what sort of nurse do you want to be? And they all say, I want to be paediatric nurses because I like children. Sick children are not fun to look after. They cry a lot. Or they want to work in ED because it's pretty glamorous on TV, but it's just not like it is on TV. So I'm an ED nurse. So it's not like it is on TV. So when I watch it on TV, I'm like, do it properly. Do CPR properly. It makes me very angry. So, and you might not know what sort of nurse you want to be, and that's perfectly okay, because you might find your niche when you've done maybe a second or even a 3rd year placement. You might be placed somewhere, maybe orthopaedics, maybe the renal ward, maybe perioperative, or maybe even in the community, and you suddenly go, wow, this is what I want to do. So it doesn't matter that you don't know what sort of nurse you want to be at the moment, because you're going to learn all those skills which will be transferable to whichever ward, department, genre of nursing that you go into. All right, so if by the time you've done your first placement you're thinking, oh, I really don't know if this is for me, hang in there, because by the time you then go into a second year placement, it starts getting a bit more nursey. You might be on a really busy ward, or you've walked past a ward and you're like, oh, that looks interesting, and then it starts piquing your interest. So just go with the journey and see where you end up. So what are we going to be learning about? So lots of stuff. So I don't want you to be overwhelmed. That's why I'm saying find a person. All right. In first year, lots of fundamental knowledge, skills. You're going to be learning about, I'm just going to go through your topics, Australian healthcare system. So we're going to look at where you sit as a nurse in the Australian healthcare system, learn about your code of conduct, code of ethics, our framework that we work under as a nurse and as a student. Really important to learn about the multidisciplinary team, and that also happens in that topic. We learn about communications. You've got a whole topic about communication, right? Because it's not just chit-chat. There's about picking up symptoms. There's about, the verbal, non-verbal cues. There's multicultural conversations. There's so much that you need to learn. How do you talk to a health professional? What you should and shouldn't say, those sort of things. So there's lots of stuff in the communications topic which is important and underpins your placements. In first year, you've also got anatomy and physiology. You've got to know what bone's connected to what, don't you? And alongside that, you're doing health assessment. So for example, in anatomy and physiology, you might be learning about the lungs, the structure of the lungs. What do they do? What are they made of? How do they work? And then in health assessment, you might then be learning, how do I assess someone's breathing? How do I listen to the lungs? And that's when you learn, we teach you how to listen to a person's and what sounds to listen for, whereabouts to put your stethoscope. So you should be learning these things in tandem, all right? So these are all getting you ready for your placement, a bit of hands-on stuff. First Nations health and cultural safety, very important. We instill that in first year, and it's usually carried through in themes throughout the other topics. There is a research and evidence-based practice topic, probably middle of the year for you guys, at the beginning of the year for the EN pathway. It's an important topic, research, okay? It teaches you about the evidence-based practice, which is what all of our nursing, everything that we do in nursing is based on someone having done a study somewhere to see what's the best way to do something, all right? So sometimes students struggle a little bit with research because it's not nursey clinical, but it's really important because not every student goes into clinical nursing. Some students go into research. And it's a really important field as well, because as a nurse, you're at the ground floor, you can see things are happening, you can see what needs improvement. And if you have that research skill, you can actually make some movement and some traction in that area to make changes. So that's really important as well. In second year, we start getting into the chunky, nursey topics like pathophysiology, like what is happening in your body? What is that disease process? What's going on? So our patho, there's two of them, beginning of the year and in the second semester. So it's combined with pharmacology and nursing care. So both of them are integrated like that. So you're learning about, let's say you're learning about diabetes, what's going on in the body with diabetes. Then we're learning about what medication do we give for diabetes? Are there side effects to this? What do I do as a nurse? What is my care involved in this? So it's all integrated, so between those two topics over the whole year. We also, in second year, focused on mental health, because not everyone comes in with just a broken leg or just diabetes or just something. They sometimes have lots of other things wrong or conditions that you need to be aware of to be able to treat as well. What else we've got? National safety and quality health standards, really important that you are able to work to these guidelines. So that's instilled heavily in second year. And legal and ethical considerations. All right, nursing is a very ethical career. We adhere strictly to guidelines and framework, which is why we are always voted almost every year as the most ethical and honest career. So it's a fantastic career to be heading into. So that's a big year in second year. Also in second year, you've got 2 placements. I forgot to tell you, you've got a placement in first year as well. aged care at the end of the year. Usually aged care, right, subacute, something that just to dip your toe into the water, see what it's like with shift work, get out there in the healthcare industry, working with some health professionals for the first time, all right? Second year when you do 4-week placement in semester 1, 4-week placement in semester 2, maybe going out to do some ward work, could be in community, could be in the jails, pretty exciting there. Lots of different areas to do placements, actually doing 24/7 shifts, okay? Jodie will talk to that as well. So you're getting you more into that nursing field. So 4 weeks is a nice chunky time to get a really good handle on nursing. So then we get into third year. There's only 4 topics in third year. Doesn't that sound fantastic? Only 4 topics, how easy could that be? They are big topics though. All right, so one of them gets you ready for your TPPP. So that's your first year out, your transition to professional practice when you apply to industry to come in. You apply to industry to do that first year out, and we teach you a lot about, there's obviously underpin all the code of conducts. We remind you about those really important things and then help you with your applications and your CVs and those sort of things to get you ready to apply for that in the middle of your final year. Okay, also in third year, you'll be doing your first 7-week placement in semester 1. 7 weeks. You feel pretty nursey at the end of 7 weeks because you're right in the rhythm of things. All right, and then in your final semester, you've got what's our last topic? Care of the chronic complex patient, something like that. It's a little bit different to the other ones because it's kind of like out of hospital care, but it's good to give you that scope that you need to have. And then you do your final 7-week placement in the second semester, and that's it. Then you're going to be a nurse. So there's lots of hands-on stuff. We do about 960 or 980 hours, I think, of placements. So lots of experience out there. Industry love the Flinders students because we get lots and lots of hands-on experience. So when you're out there applying for your TPPPs and you're providing all that documentation from your placements of how fabulous you've done and what sort of skills you've done, they all love that. So over those 3 years, you'll have 5 placement topics that you'll do. Before each of those placement topics, you will do your clinical intensives in the labs. Okay, so this is compulsory attendance. So you will be attending 4 days, and in those days you'll be doing. I think we might be doing shift work here. I'm not sure. It depends on our numbers, but 8 till 2 at least. If we've got lots of students in the labs, we'll be doing a second class 2 to 8. So you'll be learning all your skills each day, all right, and getting ticked off on some skills that you'll be doing. And on day 4, you'll be doing a demonstration of safety assessment as such. And that's really important because that then tells us if you're safe to go on placement, all right? So you're scaffolded with the theory, then you get to practice these skills in the lab so you've had that experience, and then you do your test to do that. And within those placement topics, you also have to do medication calculations every one of the topics, so you'll do it 5 times in that year, and they are what we call a non-graded pass, but they're a hurdle assessment, so you must pass your medication safety test, you must pass that final demonstration of safety that we do in the labs. That is a requirement for our accreditation and a requirement by industry that we've deemed that you're safe. So, and we've said, yep, Mary Jo's safe, she can go to placement because they only want safe students, don't they? Your clinical intensives are compulsory. You must attend those 24 hours of simulation. Classes generally, I really hate, I'm going to say this out loud and I don't want to say it out loud, so if you can forget it really soon, that's good, are not compulsory. But I would strongly encourage you to come to class. If not for the networking factor, it's the opportunity for you to ask questions of things you don't understand. All right, our classes are generally only small. We only do about 30 students in classes because that's important for you to sort of have that community as well. All right, and generally students feel get into that routine and you have a good relationship with your tutor and you feel okay to ask those questions. Really important that you feel safe in the class to ask questions. Okay, I know I said before if you're shy, you didn't want to ask questions in front of the whole class, that's okay, but at some point you need to email that question to your tutor or your topic coordinator so that you don't go home going, oh, I don't know how to do this because I didn't ask, okay, because our job is to help you. So make sure that you're asking those questions. Yep, done that, making sure I ticking all my boxes up here. I don't want to forget to tell you stuff. So that's it. Has anyone got any questions so far about that? I haven't scared anyone away yet. That's good. Okay. All right. This is basically what your study plan looks like. Usually if you've asked for a study plan, you'll receive something that looks like that. So on your left-hand side is a full-time study load. They are your topics, all right? And you'll see that some of them, there'll be red underneath. These are called prerequisites. You need to make sure that, by the time you get to, say you're doing this topic, you won't be able to do, say, 2026 unless you have done anywhere as 2020 and 2022. So you need to pass these hurdles as you're going along. There are some topics that are not prerequisites, and sometimes if you happen to be unsuccessful at a topic and you might need to do it again, there might be some other topics that you can do, and we just get our course enrolment advisors to reshuffle your study plan a little bit for you. Okay, and here is just a part-time study load for a first year. I'll talk a little bit about part-time because I think is most everyone enrolled full-time? No, part-times, that's great, that's good. So we'll talk a little bit about that, about the options of going part-time, because it's important that you do acknowledge at some point if things are too much that you can go to part-time. The BNGUC, Enrolled Nurse People, that's just a copy of what your study plan looks like and how your journey will look like for the next 2 years. That is also something that, if you also choose to go part-time, can be split up over 4 years. Okay, we try to be flexible where we can. Right, first and second year topic coordinators. So big list of names here. You're not expected to memorise these. And when you start in your topic, usually there will be a video that your topic coordinator will do so you can see what they look like and they can have a bit of a 5-minute chat about what they're doing in their topic. You will see that a lot of our topic coordinators will do multiple topics. I do ask that, hence I put this in here, that when you are corresponding with your topic coordinator, that you use the topic coordinator email. So I get emails for my topic down the bottom. I get them to my personal email, to that email, and if I get sometimes there will be a day I have 100 emails from all sorts of different people for different reasons, and I might not get to yours quickly. Okay, so for example, when I'm in topic, I make sure that I look at my email, my student email or my topic email box regularly, and so I'll answer my students very regularly. But if I'm outside of that or I've got my course coordinator hat on, it might take me 1 or 2 days to even look at that. So it is important that you use your topic coordinator's email. They might be away sick and someone else has taken over, and at least that person can then deal with your queries. All right, so try and always do it to those, and then you have a nice trail. You'll see that, which is new that I've put in here this year, under some of the topics at the very top, the first 4 topics I've got S1 and S2, so semester 1 and semester 2. So that is new this year, and that's our mid-year intake. It's a very big project that is rolling out, so all this yellow stuff is brand new. So this is where you're starting in this first blue section. You're starting there this next week, and this yellow section is semester 2. All right, so our mid-year intake is rolling out as of this year, and we're doing first year only. So what that means is what's available in semester 1 now will be available in semester 2, okay? And then the semester 2 topics that you do, First Nations, psychosocial, the other ones, they will now be available in semester 1 next year. All right, so if someone's taken a gap 6 months, or perhaps they've failed one of these essential topics in the first, they can then go into it in the second semester. So as of next year, the calendar will look quite a bit hectic for us, because all the second year topics, which are usually available twice, will be available in both semesters. So it is helpful for some students if you are unsuccessful with some topics and it's a prerequisite, for example, and you can sort of, instead of putting a year onto your degree, it actually brings it back and I'll put maybe 6 months on. So which is, I promise you, will be very helpful if you ever need that. But it also means that, students who do want to take that gap year, they can come in halfway through the year and still keep going with their regular enrolment. So that's rolling out at Bedford Park campus and also FCC, the Flinders City campus. So we're doing it in parts, like I said, this year, first year, next year, first and second year, and by 2028, all the topics, first, second, third, will all be available in semester 1 and semester 2. What else is new? The new uniform rollout. Has everyone got their uniforms? Of course you haven't, because you... Or who has? Are there people? The uniform people are here today. Yes, Jodie's nodding to me. So Valerie Travers will be here today. So our new uniform is the navy blue scrub with the yellow stripe. There were some issues, some hold up last year with some transport issues. That's under control now, I understand, and we have lots and lots. And he will be here today, Dion will be here today with uniforms for you to try, buy, purchase. Okay, that is that. Anyone from who's enrolled from this year, so all of you guys must have the new uniform. There's no point going onto Facebook and buying secondhand old uniforms because they're going to be phased out. All right, so as a first year, you might just as well get your new uniform now because you'll be using that for the next 3 years. Yep. He's going to be on, where is he going to be?
302.
302. From what time? When we finish here. I'm not going to tell you he's available now or anything because I need you to stay here for my talk. So after the talk, he will be available room 302 with uniforms. Okay? Yes. You need to be wearing your uniform. I understand that you need it for 1023. I know that the NURS 1023 health assessment, you will require to be wearing your uniform for one of your last assessments, which is a video. But you definitely need it for your intensives and your placement. So if you go into the lab, you must be wearing your full uniform. Closed-in shoes, dark pants, scrub top. Okay, so intensives. Pardon? This year, yes, because you'll be doing labs and 1023, their final assessment. I understand Kim says that students are expected to be in their professional uniform. Yep, at the back. Can you get them from Bedford Park? Yes, so I'm doing the same thing again tomorrow and Thursday, and he will be set up at Bedford Park from midday for 3 or 4 hours. And also he will be regularly coming to campus, I think monthly, Jodie? Yep, monthly, with uniforms for people to make sure that they've got them. So, yep. Any more questions about that? So, yes, so we've got the new rollout. I know I've got new enrolment location because I used some of these slides for Renmark when I went to Renmark last week so that they know about our shiny building here. But obviously you know about it because you guys are enrolled here. So the FCC enrolled pathway was only new this year, so you guys are all our little pilot cohort to see how you all go. There will be classes, although if you've enrolled in FCC pathway, as in that's the location you've enrolled at, all your classes will be here, okay? Our brand new labs will be starting this year, will be built by July, I believe, and you'll be doing all of your placements and all of your labs here, okay? We are offering some flexibility for our Bedford Park students, a couple of classes for each topic where they might be able to come here and do theirs as well. All right. Yep. I will tell you about it, but we do have an asynchronous. I mentioned that before, the asynchronous offering. So this is no tutorials, no lectures, nothing. It's independent learning only. It's only a very small cohort of about, I think, 80 at the moment or something like that. So that's being offered this year for the nursing program. I'm simply letting you know because it is one of our new programs that we are doing. And students cannot just swap and change. So I would say ideally this is your best pathway. Nursing relies a lot on communication, and for young students who have either come straight from school or close around that time will benefit mostly from the format that we do here, where you go to class and you have that interaction and you have tutorials to go to guide your learning. So, yep. Tori showed you this about the course representative, so I have put my email at the bottom of this as well, and I feel I've forgotten to, but I will put up an email on the BN course page, which I'll talk to in a second. So if you're wanting to be a student representative, yes, it looks great on your CV. Yes, that's fantastic. However, I do need you to be active in that space. Okay, so last year we people who might put their hand up, but then they aren't active in that space. So it's not just about putting it on your CV; it's about being that advocate for your year. We usually like a couple from each year because sometimes you might be busy, and the other person who's in that same year can step in and go to the meeting. So I will normally meet with the year lead. With our year coordinators and the student reps probably 3 times a year to see what's going on, what's happening out there. Do you like the food in the cafeteria and all that sort of stuff? I get all these sorts of things, and that's our chance to have a chat. So if you're interested in being that person, then just email me and I'll put this up and you'll all receive an announcement about it anyway. Communication framework. So there's 2 pages of this, and I'll upload a copy of this so that you can see it anyway if you can't see it from there. But I guess it's important for, if you're after information, to go to the right person. Sometimes you don't know, so hey, look at this level 2, they'll be able to tell you where to go to otherwise. But when you've got something like this, if you've got a query about placements, coming to me, I'm just going to redirect you back to the placements area. All right, if you've got a question about enrolments and you come to me, I will probably redirect you back to Ask Flinders so that you can speak to a course enrolment advisor. If you've got a question about your topic and you go and ask a fellow person or someone on Facebook, you're not going to get the most accurate, correct answer. Okay, so that's why you need to be going to the right person. So these frameworks are important for you, and I think I've also got these on the BN page. The BN page is your Bachelor of Nursing page. So on your dashboard, does everyone know what I mean by dashboard? Yep, so on your dashboard, on your flow site, you will automatically have BN course information page. So that's kind of my page, I suppose. And on that page, I've got a basic rundown of the course. The framework will be on there, so you'll be able to find this framework on there. And every time I put up an announcement on there, every student will get it. All right, because I want every student to get it. Like I put an announcement up there maybe last week or something about falsifying documentations, which freaked out every student possible. That's really good because that way everyone's learnt. So I will put things on there specific for you. If I want first years to know something, I'll write for first years, job opportunities or something. So I put all sorts of things on there. The year coordinators and the placements team will also put things on there of information we think every student needs to know. Okay, so do not turn your notifications off of that one. More communication. Again, it's on the BN course page. This one's important about your topic. So just to tell you the difference between a tutor and a topic coordinator. All right, so I'll use me as an example. So I might have 500 students in my patho topic. That's a lot just for me to deal with, right? So I have tutors who teach 30 classes of 30 of these students. So the tutor is the person who's your teacher in your classroom. They're the one who's going to deliver all the content that I've provided to them to deliver to you. They're going to show the PowerPoint that I've put together of learning that I need you to do. So they're the one that you ask questions of in class if you're not sure what's going on, okay? I don't understand about this assignment, what do I do here? And that's probably not the thing to ask when you're talking about your assignments because we can't tell you the answer. What you need to say is, I've looked at the assignment, I'm not quite sure, but I'm thinking I might talk about this, this and this. Am I on the right track? And then they can say, yes, you are, or no, you're not. Don't go up to your tutor and say, I don't know, what do I do for question 1? Because you have to know that. So you've got to actually say, I think I have to do this, because that way we know that you've put some critical thinking into it. So your tutor's the person to speak to there. Then you come to me as the topic coordinator, not course coordinator, topic coordinator of my patho topic, okay? Because you want a resubmission or you want an extension request or something tragic's happened and you need to talk to me about something really serious. Then you talk to the topic coordinator, all right? So if you're not getting what you need or there's big issues or you're clashing for some reason, you might then go to your year level coordinators, and that was those people I mentioned before, okay? And in the end, still not happy about something, really fired up about something, then you come to me as the course coordinator, all right? And I will solve your problem from there. And if I can't solve your problem or I'm exacerbating your problem, you can go to a complaints area, all right? So that's the process of what to do, okay? And people go and they follow that process, and I'll even say to people, look, I think you should maybe go and put a complaint in or a grades review in. So, your topic coordinator has failed you from the topic because you haven't done an assignment or whatever, and you think that, no, I should have passed. Usually those students will come and see me as the course coordinator and demand that it gets regraded or whatever, and I'll say, look, actually, I've looked at it and people have followed the right process, so maybe you need to go and get a grade review. So grade review is in your complaints area, that's someone separate, and they look at it objectively to see what you were supposed to do, have you done it, what has the topic coordinator done, what's the email trail, and then they make a decision, all right? Students have that right to do that as well. So there is always a pathway for resolution, all right, and for communication. So we just ask that you try and follow the pathway as best possible. When in doubt, like if you write to me and you're asking me something, I'm not going to ignore your email saying, why have they written to me? This isn't my thing. I will direct you to who you need to go to, okay? Email etiquette. All right, this is important. To be polite and professional in your correspondence. So as cranky as you might be if you've got a fail grade or something for an assignment, which let's remember that fail doesn't mean 0. Fail sometimes means 45%, okay, because it's something less than 50. So take a deep breath before you write your email. But if you write a cranky email to your topic coordinator, do you think that they're going to reply straight away with sugar and spice to you? Probably not. So it is important that you be professional in your emails, all right? You be professional, you be nice, because students who write to me and they write cranky, nasty words to me, I wait a day or two while I'm sobbing. I wait a day or two and then I reply, and I often put the code of conduct in there saying you really need to make sure that you adhere to your professional standards and our student code of conduct, because this is unprofessional. All right? So there's no reason why you would be rude to your tutor or your topic coordinator. All right? Make sure that when you are using your email address, you use your student email. If I get emails from, Hot Pants 85 or Xena Princess Warrior or I'm Great, Just Ask Me at Gmail, it'll probably go to my junk mail and I won't get your email. So you need to use your student email account because we know that they will come through to us. Okay? So that's really important. And you will be taught, I feel like it's in 1020, about your signature. I think that's one of the assignments, is you put a signature together, and that's what appears on the end of all your correspondence. So they'll have, Mary Smith, I'm in this topic, this is my tutor, blah, 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 blah. That's at the bottom, and that should be on all of your correspondence in case, you just write there and sign off Mary, and I'm like, which Mary is this? All right, so that's an important thing, and they'll go through that in 1020 for you. Speaking of code of conduct, so I've just put some things on here. We actually have an important code of conduct to adhere to. This is separate to the NMBA Registered Nurse Standards of Practice, the nurse's code of conduct and the code of ethics that as a student nurse that you are expected to work under and adhere to. This is the university student code of conduct. And basically it talks about you respecting rights of others, being aware of inclusivity and upholding inclusion. We have no tolerance for sexual harassment or anything like that. And it doesn't need to be just you. If you see something happening to someone else, it would be expected that you would advocate for these people as well. So these are, I like to call them good manners, all right? But things that we shouldn't have to say to you. You shouldn't be doing that. These are things that you should automatically be doing. Oh, I just need a break for a second. All right, that's it. All right, so learning at university. So it can be quite difficult learning at university. So you are now responsible. You are now accountable. It's on you, okay? So sometimes it takes a while to learn what that looks like. And it's different for every person. So try and follow your learning journey and don't look at someone else who's doing fantastically and everything and you're struggling. That's okay. That's their journey. Focus on yours, because when you're trying to live someone else's journey, that's when it all derails. All right? So as some people, is anyone here done university before, different courses? There's a little half hand there, maybe. All right. So you might be all new to university. Let's say you're all new to university, all right? So some people are first in family, so that's added pressure to do it as well. Some important things for you to be successful is, here I am badgering on again, come to class. Really important, all right, to come to class. There is, and I see it in my topic, significant difference in grades of a person who comes to class as opposed to someone who doesn't. All right? If you come to class, you've got a PowerPoint it's usually got points that we talk and discuss to, so you write your answers down, you do all that, you're feeling pretty accomplished at the end of class. If you don't come to class, you might end up getting a copy of the PowerPoint at the end of the week, but all the answers aren't on there. You now have to go and do your own independent learning to try and catch up on what was talked about in class. All right, so coming to class is the first step to success. You can learn better in class. You can ask questions and get immediate answer. Okay, that's a really important thing as well. It's not a passive environment, so don't come to class thinking you can just sit back and scroll while you're listening. So our job as tutors is not to lecture you. So whilst today has been like a lecture, I don't do this in my classroom. We don't lecture. You are expected to participate in class. It's usually group work, questions, answers. I might ask this group, I'm going to give you a question, you've got 10 minutes to research it, then I want you to tell the whole class your answer. And then I might facilitate your answer. Yep, that sounds right. What about this? And then everyone else joins in. All right? Our job as tutors is not to lecture you. So it is not a passive. So when you come to class, be prepared to participate. If you're shy, that's okay. Like we always do group work, and there's always a leader in the group generally. But after a couple of weeks, that shyness should start to dissolve and you'll start to feel a bit more confident to put your hand up and answer questions. We're not going to go, you tell me the question, or tell me the answer, and make you all like, oh, in front of the class, okay? We want it to be a safe environment. Great chance to build relationships. So it's really to succeed at university, you've joined up, you've paid your money, you need to come to class, you need to show up and engage, okay? You will not learn anything passively if you just sit there. It's just not going to absorb. It doesn't work like that. Damn it. There's actually a bit of work to do. So basically that's about you being accountable. It is exciting and a new experience for most of you coming here to university. It's going to take a while to get used to. It's not like school. It might not be like TAFE experiences. It can be different. So we have a diverse, usually not so much in this room, but certainly at our Bedford Park campus, a diverse age group as well. We have school leavers I have students who are, how old, 71, I think she is 70-something years old. So we have this huge, diverse range. And I love that because each of these people brings something to the classroom. So I get people who come in who mature age, maybe this is their second opportunity to try and do something different, sea change type thing, changing careers, and they feel, oh, I'm old, Oh. But it's like, no, you're not. What you do is you come here with experience. Someone brings something to the classroom. So anyone here who feels that, oh, I'm not straight from school, what could I possibly be offering? You all offer something valuable and to the classroom. And that's really great. And sometimes it's something as simple as communication or confidence. Confidence in talking and that sort of thing, really important in nursing when you're out there having to talk to strangers every single day. All right, so again, your journey, a lot of you will come from do part-time work doing things. You will bring with you transferable skills that you don't even know you have, okay? So that's also important to acknowledge as well. University, again, I keep going back to your own journey because it's really important. Some people will come here and smash it out in 3 years. Fantastic, they're done, they're off, they're nurses, fabulous. Some of you might need a slower pace because you've got family, you've got sporting events, you've got commitments, you've got something going on as well in your life. And that's okay. It doesn't have to take you 3 years, all right? But it's important that you acknowledge at some point that, oh, this is too much at the moment, I can't do this. Do not struggle through, because it will just make the experience poor for you. And I want you to have a really good learning experience. So if you feel you have to go part-time, that's okay. You're not a failure. You're going to be very successful because you've got insight into what you can handle. And that's a really important thing for you to know. Okay, so you don't have to be laser focused. See how you go. That's why we have those important dates like census. Census date is a time when you've got up until that point, and it's different for each topic, so make sure you look into it, when you can go, oh, it's all too much, I've taken on too much, and you can withdraw from the topic without financial penalty and without academic penalty, meaning a fail doesn't appear on your transcript. So that's a time for you to go to reassess where things are in your life and go, you know what, let's try that part-time pathway for a year or two, and then I'll get back on track because, you know, life will be okay then. So there will be peak periods as well. There will be stress periods. We can't take that stress away. I can't take your anxiety away. It's how you cope with it. You'll have times when you've got 2 or 3 assignments due at the same time and you might get panicky and fall to pieces. Talk to your colleagues. Talk to health and counselling if you need to. They understand academic stress. But if you are organised, that might prevent some of that stuff. But just understand that a bit of anxiety is normal when you have peak periods of stress. We all know that. Could be a sporting event, you've got a grand final coming up, you're going to be stressed and nervous. No one can take that away, so it's how you handle it. You might spend the first 6 months or 12 months of your degree finding out how best to handle that for you, what works for you, okay? So again, what works for someone else might not work for you. Oh yeah, that goes back to time management. So time management, I think I've got a couple of slides on this. This sometimes will prevent the anxiety, okay? So knowing those dates is really important. So nursing runs usually from January to December. You know, we are very, very busy, so it's important to know those dates. Know your assessment dates. Put them down. That's why I said Flow's open, your Flow Canvas sites are open now. Look at when all your assignments are due. Jot them in your diary. Don't start them the weekend beforehand. That fills me with anxiety when I hear students do that. Start working on them slowly, making sure you're checking with your tutor. I'm going to talk about this. Think that's on the right track here? And I say, yep, that sounds right. Then you feel confident going forward. Holidays and time away. Now, as the course coordinator, I often get students saying, oh, look, I've booked this fantastic cruise and so I'm in this topic and I'm going to be away for 6 weeks of this topic and, you know, is there anything you can do about it? No, there's nothing. I'm not being mean, I'm following policy. Our policy says do not book a holiday before your timetable is finalised. Do not book a holiday for the day after your week 6 or week 12 because you might be doing a resubmission or you might still be waiting for something, all right? So if you've booked holidays, you know, holiday of a lifetime, I want a cruise, I'm going to Paris, fabulous, good for you, that's fantastic. But if it is during a topic and you require an extension request of 2 weeks because you're holidaying in Paris, you will not get any extension request. That is not extenuating circumstances. You need to make sure when you're booking your holidays, that's why I say to you, book all your classes, get your topics organised, find your gaps where you can have your holidays, all right? We don't make exceptions for that, especially when we get to the 6-week topics. It's 6 weeks long, that's it. If you're away for half of that, you need to withdraw because we can't wait 3 weeks for you to get back from holidays and get it together because we hire tutors and we have a schedule, we've got placements, everything is pinging all these times that we have on your timetable. So be organised. And the hurdle assessments, as I said, they are compulsory. Oh yeah, there's some. Now these key dates, like, I'm not going to say take them with a grain of salt, I'm going to say go and look at this website and make sure it is specific to your topic. Placement topics have a different census date, so just make sure that you're aware the university will send out emails about key dates. So you will find that you'll get lots of emails from the university. Try not to go, oh, so many, I'm not going to read them. Try and make sure that you just skim the ones that come through so that you are aware. Time management, this is, oh gosh, one of the things I love to badger on about as well because just because I am super organised. And because of that, I know when I've got things due. All right. When I was a student, I had kind of had something that looked like this second picture on the right-hand side. And I had post-it notepads and calendars and big crosses, and I never was late with an assignment. That's okay. Sometimes you're late with assignments, and it is what it is. But you need to find what works for you. Are you a IT guru and you want to set it up on your phone or Outlook, or are you someone who needs a pin board where you can put post-it notepads? Are you someone who can write all over a fridge potentially, not the family fridge, or a diary? Do you have a diary that you flick through? Find something that works for you so that you can be prepared. Not just, my assignment's due on Friday. How did that happen? It's like you should be able to have a glimpse of something to go, I've got an assignment due in 2 weeks, so I need to really start working on that. Okay? So having a diary and things like this means that you can map out your day. Now, for example, say you're doing 4 topics. Maybe Sunday you might need to prep for Monday's class. That happens, right? So maybe you need to do that on Monday. Monday you're doing this topic. Tuesday I'm going to prep and do this topic. Wednesday and by Thursday, okay, I've prepped and I've done my 4 sessions. On Friday, I'm going to pick which one's the most challenging. Which one do I need to put a bit more work into? Or maybe on Friday, I'm going to split it up and spend 2 hours on each of the topics, starting one of the assignments that I'm looking at, and just start that work going, all right? So you need to find what works for you. I know that a lot of students have part-time commitments. They have families. They have sports. Some people have children. So there's a lot going on. No one has the ideal, I'm a student life, I live at home, I get fed 3 meals a day and scooted off, I don't have to pay any bills. There's not many students that have that ideal lifestyle, all right? So we all struggle, so you need to find a routine that works for you. I can't stress that enough. Now, don't feel panicky going, I need to go home and find a routine. It might take you 6 months to come up with something that works for you, okay? So just because it works for someone else and they're managing, that's good. It works for them. It works for their head, their mindset. That's great. Find something that works for you. I thought of something very important while I was waffling on about that. I'll come back to it. Start assignments early. Yes, that's why I'm saying it's week 0. Haven't you opened up your sites yet? So you can have a look, all right? Don't forget, you've got family at home. Don't forget to feed the dog. Okay, don't get so focused on your studies that you forgot grandma's birthday or something, all right? You still need to have your family and your personal life needs to somehow meld with your study, okay? And it might take 6 months or so to figure out how to make them meld and remember that, what's the dog's name again? Okay, you've got family and friends who are all around you who will also support you in your studies. Don't forget them. And also especially, don't forget your reward time. If you're so focused on your studies and I'm doing my studies 7 days a week, you're going to lose your enjoyment for your studies. Make sure you have at least a day off, at least. Go out to the movies and have coffee and cake or go out with friends. Make sure that you have your rewards. You might set it going, you know what, I'm just going to smash it out for 2 weeks. I'm just going to study hard for 2 weeks and then I'm going to take 2 days off. You've got a goal to work towards. You've got something fun to work towards. Always have that there for you, all right? I never used to study on a Sunday. That was always movies day or something like that, always. So you have to have that. That way you can keep some enjoyment in your life. There was something I wanted really important, and I know I'm going to have to come back to it. I'm sure it was about assignments too. So, yeah, I'll come back to me. Self-care. Self-care is important as a nurse, okay? So in nursing, self-care is not a luxury, okay? It is essential, okay? Because burnout in nursing is a very real thing, okay? So we want to make sure that we get you organised early, into a routine early of looking after yourself. And I always go back to the analogy on the plane, the oxygen drops down and they say to you, if you've got children, put it on yourself first. And as someone who has children, I'm like, no, I need to put it on my child first. I need to look after my child. But in the meantime, I've then passed out from lack of oxygen. And so then I haven't got the oxygen mask. They haven't got the oxygen mask. So I need to look after myself so I can look after this person. In your nursing studies, you need to look after yourself, all right? In nursing, you need to look after yourself before you can look after your person or look after your patient. Because you need to have a good head on your shoulders, you need not to be stressed, not to be anxious, because when you're stressed and anxious, you forget things and you can't think straight. So there are lots of things you can do. I've written down 3 things here, which, you know, they're probably good things. Exercise. Aim for 20 minutes a day. Tori was doing, what was she doing? Leg stretches or something down here? Whatever. Don't just suddenly go and join a gym because I've got to do something for 20 minutes a day. If you're not a gym person, don't join a gym. Go walk somewhere. I remember when I was doing my PhD, I used to walk a lot. And I'd think of all this good stuff because all the oxygen's flowing and all these brain cells are working suddenly. I used to think of all this really good stuff. I probably should have written it down when I got back from my walk because I would say, I've got to go and write that down. I never did, but I thought of really good stuff. All right? So get the oxygen moving, do some exercise, and it's good too. You don't want to be stuck on your chair doing your study all the time. Eat well and stay hydrated. The brain's made of lots of water. It needs water. All right? So I note lots of bottles of water in the room. Fantastic. Keep hydrated. And sleep well. Sometimes that's easier said than done, but sleep, honestly, it's highly underrated. It is really important that you get into regular rhythms of sleeping. All right? So working a night shift, then coming into class, that's not ideal. Yes, you're physically going to be there, but mentally you won't be there, so it's just a waste of time doing that. All right, so try and look after yourself. Your sleep deprivation will affect your mood and your concentration. All right, these are just ideal things. Not everyone's going to be able to do them, but try and do some, right? So nurse burnout is real. So self-care, physical, mental, emotional, make sure that you look after yourself in this area. And sometimes you find out the hard way. Right. Now, there was something very important I had to say, and I cannot remember what it is, but I will remember. Let me just see what the time is, because my person's gone away. Time management. Let me just check what the time is. All right. How's about we have...
It is time for a break. I'm interrupting.
Good, thank you.
Yes, we're going to have a break outside, and we're going to use this as an opportunity to get a sugar hit. There's donuts, but also an opportunity to mingle. Stretch legs. So what I would like is everybody, I'll go to the door, just grab one of these coloured stickers and that'll correspond with a donut box, and then you can meet new people and have a chat. So we're good to have a break?
Thanks. Oh.
Everyone's listening to me, so you'll know. I've run out, but I'm going back to get more. If I missed you, that picture at the door. Yeah, 1, 2, 3. Raise that one as well. If you've got one, you just go like that around that way. No. You don't need any. Now remember what's in the generally over that side.
Oh, yeah, sorry, yeah. They're all on that side. Right.
Are you rushing me? I'll try and get it done as fast as I could.
Oh, I think it's
Yes, just think.
yeah, this is the easy. Yeah, we're just having a quick break. Yeah, so if you take some of these.
Oh, so where are they getting their donuts?
They're just Krispy Kreme boxes out there.
Oh, right.
I wonder how many stickers they had in there because there's only
Ooh, not many left.
some other people.
Just getting late in the
It's
day.
gonna hit a tipping point.
Well,
I just need to take something.
Was that alright? Yes, I should double check those.
Betty and
They're all on this side of the far side of the building.
I'm half an hour careful.
There's
Sorry, I have a quick question about this uniform. So I got an email saying that I think the dad was gonna come in and check the sizes for the top.
Yes,
Is
he's
that
coming.
still happening?
Yes,
Okay.
after the session in 302.
Oh, 312.
312.
Okay.
Yeah, after the session, I'll remind, Jodie will remind everyone.
After that, we'll go through,
I reckon, yeah, you do, everyone need to. Yeah.
so maybe after I've done the idea, I will get into
Well, I went in with Well, I told him she didn't respond to
Well, I didn't want to, but
I escalated it to the deputy dean, and she wanted to get a working group together. And I'm like, oh,
no, it's not gonna, that's great, but that's not gonna.
I didn't expect you. We might do.
Is this working? It is. Yay. So you all sugared up now? Ready to hear the exciting stuff about placements? We'll just wait for everyone to come in. Okay, so my name's Jodie Price. I'm one of the placement education coordinators for nursing, and we're going to talk about the really exciting stuff of placements now. So that's what you're here for, isn't it? To work as a real nurse. Okay, so when you do your placements in first year, you'll do 2 weeks, and that will predominantly be in aged care or very, very low acuity hospital setting. Okay, in second year, you'll do 2 4-week settings, 4-week placements, sorry. So 1 in the first semester, 1 in the second semester, and then in third year you'll do 2 7-week placements. So you get lots and lots of experience with placements over your degree. Okay? Now, when I talk about placements, what do I mean? I mean that you'll be going into an aged care environment for your first year placement. You will go to a hospital setting, so you'll go to an SA Health setting, so the RA, Queen Elizabeth, Flinders, Lowell Mac, or you'll go to a private venue. So we have lots of private venues as well. So Calvary, Flinders Private, Ashford. We send students everywhere. We send students to prisons, and everyone goes, oh, that's a bit scary. It's actually not. Very, very interesting placements in prisons. Okay, the students that have been there have loved it. Really good experience. We send students to community centres for community nursing. We send students to the Northern Territory for placements as well. So you can opt to go to the Northern Territory. You can go to Darwin, Alice Springs, Nhulunbuy, Tennant Creek or Katherine. Okay, so we have lots and lots of placement opportunities for you. And for the Northern Territory placements, we actually send out an expression of interest. So you actually apply for that position and say where you want to go and what you're interested in, and we give you what we can. Okay, so really, really exciting. So when you're on placement, you will be working with registered nurses. When you go to aged care, you might work with a carer every now and then, and an enrolled nurse perhaps. And then from then on, you'll be working with registered nurses all the time. Okay, that's what you're going to be. You're going to be a registered nurse. When you're on placement, you'll work a 7-day roster and 24-hour shifts. So that means early shifts, 7 till 3, afternoon shifts, maybe 2:30 till 10:30, and night shifts. That might be a 10-hour night shift, so it might be a 9 till 7, or it might be a 10:30 till 7. Okay, so you do all of those shifts. You'll work Saturdays, Sundays, public holidays. Okay? Now, if you're sitting there thinking, I don't want to be doing that, well, you need to think, is this what I want to do? Because that's what nurses do. That's what majority of nurses do when they're working in a hospital setting. Okay? If you go to a GP clinic, well, then you'll be working maybe Monday to Friday, 9 till 5. But that won't happen very often. Going to a GP clinic, you might get that for 1 placement. Okay? So, it's exciting. You'll get to see so many things when you're out there being a student nurse. You'll get to see everything. You'll be working right alongside those registered nurses. Okay, just going to check my cheat sheet because I've got lots of information I want to make sure I get through. So with your shifts, you need to make sure that you can work those shifts. All right, so if you've got family at home that you're looking after, you need to make sure that you've got strategies in place so that someone can take the kids to school when you're working those early shifts, or someone can pick the kids up from school when you're working an afternoon shift. Okay, so make sure you've got strategies in place, you've got family, friends, all that sort of thing that can help you get through the next 3 years of your degree. It's really, really important. Now, there is the Commonwealth PRAC payment that you can access when you're on placement. You have to be able to provide the government with specific eligibility criteria to meet that, to be able to get the CPP. Not all students can get that. So if you want to find out a bit more about that, you can go to Flinders. The website has a CPP a page that you can have a look at, okay? And that will give you more information about that. All right? So it's good if you're eligible for it. Okay. The other thing is, as Danelle said before, don't book holidays. Don't book holidays until your placement dates are confirmed with you on InPlace, okay? If you are booked to go on placement and you're also booked to go on a holiday, well, then there won't be any movement. We cannot move your placement because you have a holiday, okay? It will be you need to cancel your holiday and do your placement, or cancel your placement and come back the next year, okay? There is no movement. We have about 6,000 placements a year that we do. So we cannot move placements. We are reliant on SA Health and our private providers in giving us specific placement dates. So we cannot move those dates. Okay? So don't book holidays. You often do a 4-week, well, when you do a 4-week placement or a 7-week placement, sometimes you might have makeup shifts to do if you're sick. Okay? So don't even book a holiday the next week, because you might have had 3 days off sick during your placement. You need to make up those days. Otherwise, you can't actually finish the placement and pass the topic. Okay, so don't finish placement on a Friday and book a holiday on a Saturday. That won't work. All right. So placement is very, very exciting. So there's also the Clinical Placement Collaborative, which is an initiative with the SA government that will place students as close to their home as possible. So you can opt in or out of this collaborative. What it means is that if you live in the centre of Adelaide, you'll predominantly get Carlin placement. So that's the central health network. Okay, so it's the RA, Queen Elizabeth, those sort of placements. What it means is that you go to the same environment maybe multiple times during your degree. You get used to that environment. You can get education opportunities at that environment. You can potentially get AIN positions, so assistants in nursing positions at those environments, and it helps you when you're a TPPP. Okay, so your TPPP is your transition to professional practice. When you're an RN, that's your first year out of your degree. Okay, so it's a bit of a stepping stone that the government has recognised. It's good to put students as close to their home as possible because they'll probably want to work in those environments. All right, so it's a really good thing to do. It doesn't mean that you are stuck there forever. You can change your decision at any point and say, I want to go outside of my local health network. So I might live in the city, but I decide, actually, I want to go to Flinders for a placement. You can let us know and go to Flinders. Or you might say, I want to go to Lyle Mac. Okay, so there's lots and lots of opportunities. You will be required to do a rural placement at some point in your degree, and a rural placement gives you excellent opportunities to see what happens in a rural environment. It's very different to working at Flinders Medical Centre or the RA. Okay, so that's a really good opportunity as well. So when I say a rural placement, it might be Mount Barker. That is still considered rural. Just semi-rural at the moment, I guess. Or it might be Mount Gambier, might be Cooper Pedy, might be Port Lincoln. Okay, we send students all over the state, and as I said, into the Northern Territory as well. All right, so lots and lots of places to go. For some places, when you go rural, you will get accommodation provided at a small cost. In some places, you have to pay for that accommodation, but you get a certain amount reimbursed after your placement. Okay. All right. We will keep moving along. Let me see what else I haven't talked about yet. Okay. So if we go to our next slide, to be able to go on placement, there are some really important things that you need to meet. and that's called placement compliance. So in a minute, I'm going to take you to the placement site and look at those compliance requirements with you. You need to get really familiar with that placement site. But before I go there, I want to tell you about some other opportunities that we have. So I talked about the Northern Territory. Okay, we offer a lot of specialty programs that students can apply for. So we've got a women's and children's mental health specialty program that students do a mental health placement at the women's and children's for 1 or 2 of their placements. We have Flinders Private specialty stream. With those ones, you apply for the stream and you get guaranteed an interview. So you do your 2 third-year placements at Flinders Private, and we're starting that up with Ashford as well. You then will get guaranteed an interview for their graduate nurse program on completion of your degree. Okay? If you're successful, you do work then at Ashford or Flinders Private, and it's really good because you actually know the environment. You've worked there for 14 weeks in your last year of your degree. You know them, they know you, you know the routine. It's not so scary when you start your first year as a registered nurse. So I would highly recommend you think about that pathway if those sort of things interest you. Okay? So, just going to take you out of this page for a minute and show you how to get to the placement page. So, and I haven't got a mouse. Do we have a mouse? Right. So, if we go to Google and you put in there Flinders undergraduate nursing. I'm surprised that I can spell because normally, said that too soon, didn't I? Okay, so actually I should have put placement. That will be more specific. Okay, this is the site you really need to get familiar with. So this is your undergraduate nursing placement experience page, okay? Gives you lots and lots of information. So to be able to go on placement, as I said before, you need to meet compliance. So compliance is around about 25 to 30 documents that you have to complete by a certain date for us to give you a placement. If you don't complete them by a certain date, you do not get a placement. Okay, if you don't get a placement, you don't pass the topic and you have to repeat that year. So compliance is really, really important. You will have some announcements coming out on your flow pages next week about compliance and about what to do every week to be able to get compliant on time. Okay? So if you think about it, when you're going to the RA or when you're going to Flinders Private or when you're going anywhere for a student nursing placement, they don't know you. You are a visitor to their space. Okay? Now the RA might have 100 students going there on placement per placement block. So what the RA want to make sure is that all of the students going there are immunised, know how to do CPR, know how to do manual handling, don't have anything dodgy on their police clearance, and are a good, outstanding citizen and have done blood safe, infection control, hand hygiene modules, all of that learning that they would expect a registered nurse to do. Okay, because you are coming into their area, you're coming into their space, you're looking after their patients, you're working in the ward next to their staff. Okay, so that's your placement compliance. That's why if you don't meet it, you can't go on placement. So it's not the university that sets this placement compliance, it's our venue partners. So it's SA Health, it's our private sector. Okay, they're the ones that say your students have to have this before they can come to us. All right, so this site, go over here to my mouse. This site has all of the information that you need to know about your placement compliance. Okay, so you can drop down little arrows here. It tells you about every single thing you need to do here, and it even gives you a link to some of the things that you need to fill out. All right. A lot of these things, so some of these things need to be done every year. Some just are done once for the 3 years, okay? Some of them will take you 6 weeks to do, so your NDIS clearances, your working with children, your police checks, that sort of thing can take 6 weeks, can take 3 months when they get really, really busy, okay? And we're about to head into a busy time because there's lots and lots of students starting at university applying for these checks, So the sooner you can apply for them, the better. Things like your immunisation schedule, that also takes a lot of time, especially if you haven't had Hep B injections, which probably most of you would have had, I would have thought, at school. But if you haven't had them, or you need to have another course of them, that can take 6 months, okay? And your compliance date is July. So working that out doesn't quite work, does it? So you need to get on top of these things really, really quickly. And if you are in a position where you're not going to be compliant by the compliance date, you need to tell us. And then we might be able to work with you. Might, depending on what it is. Okay? So this is really important, this site. You need to know this site like the back of your hand. All right? I want you to look at this site tonight, and I want you to have a really good look at what you need to do and work out a plan for your compliance.
And compliance is every placement topic.
Every placement topic you have to be compliant for, okay? So your compliance also has to last till the end of your placement. So say I'm going on placement this week and I finish on Friday, but my manual handling and CPR run out on Wednesday. Well, I can't go to placement because it doesn't cover me for that entire period, okay? So it needs to cover you for the entire period of your placement. So if you go up here, there's a couple of yellow boxes. It's a funny little microphone, this, isn't it? It's a bit weird. Okay, placement calendars. So this gives you the dates that you need to be compliant by. So you go through here, you have a look at this, 1027, which is what most of you will be in. Your compliance date here is the 10th of July. Okay? So that means by the 10th of July, you have to have all of your compliance documents uploaded to a portal called InPlace. Thank you. So InPlace is something else that you add to your Okta dashboard. So InPlace is the system that allows you to go in, upload your compliance. It allows you to go in and see where you're going on placement, the dates of your placement, and who your clinical facilitator is when you're on placement. So your clinical facilitator is someone who is going to be supporting you alongside the registered nurses. Okay, so you'll work with the registered nurse for a shift. They're your preceptor, and the clinical facilitator will come in and see you, usually 2 or 3 times a week, take you off the ward and say, how you going? What's happening? Tell me about your patients. Okay, this is wrong with this patient. Why do you think he's having this treatment, or why are they having this medication? So they help you to develop your knowledge and understanding of what's happening with your patient, which is really important as a registered nurse. Okay, so this is one of your little documents that you need to print out so you know when your compliance dates are due. On here, there's also a clinical orientation date. That is an online meeting that happens with your topic coordinator, and your clinical facilitators attend that meeting, and they talk to you about placement and about what to expect on placement and what the expectations of the topic are. Okay, so really, really important that you attend that. If you're going to a rural location for your placement, we'll also have a drop-in session where you can come. That's also listed on here. And you can just ask questions about your rural placement. Okay? Now, on the BN flow page, which Danelle talked about before, so on your Okta dashboard, you'll have the BN flow page. There's an area on there for placements. All of this information is on there, okay? Lots of information there about placements. If you've got questions, the best people to go to are the placements team. So you can email them, and I'll put their email address up here in a minute, but it's cnhs.placements@flinders.edu.au, okay? They are the key to all of your placement information. So there's about 6 people in that team that will be able to answer your questions, all right? So that's one document. If we go back to the page here, the next one is your pre-placement compliance checklist. Now, this is a big document. This is what you need to meet to be compliant to go to placement, okay? If you don't meet all these requirements, you won't go to placement. So up the top, it tells you red, orange, green, blue. Red, high priority. They're the ones that are going to take you the time. Okay? TB screening has to be done before your immunisations, because if you do your immunisations first, that can alter some of your TB results. All right, so make sure you have a really good look through that page and have a look at this. It sort of goes on forever. It's really, really important that you get onto this as quickly as you can. Print it out tonight when you go home and start making a plan for what you're going to do when. All right, so everything's colour-coded. Red means, yep, get onto that ASAP. Blue, so influenza and COVID-19 vaccinations highly recommended. Not many venues will say that it's an absolute requirement nowadays, but some will, okay? Then you go into your yellow, your CPR, your manual handling. You need to book in for them. Won't take you as long to book into them. And then most of these are electronic, so you'll do them on your computer. It'll be a module on your computer. You'll download a certificate and then upload that certificate to InPlace. Okay? And then the placement team go into your individual InPlace, remembering that we've got about, 2,500 students. They check every single compliance document for every single student. Okay? So they've got a massive job. And as I said, they're the experts on compliance, so if you have a question, you email them. All right? Everyone happy with that? Yeah? Now, this compliance is not something that once you're finished being a student, you never have to do again. As a registered nurse, you have to do continual updates every year, manual handling, CPR, medication calculations, every single year. Working with children check, police checks, okay? This is not something that is just to be a student. This is something for your entire career. All right, so get used to doing these compliance requirements. If we go back here again, there is a process sheet that you can have a look at that tells you, if I have a problem with this, who do I go to? Okay, so print out that as well, because that's really, really important and will give you a lot of information about what to do and who to contact if you are having trouble with your compliance documents. Okay? Any questions so far? Have I scared you all away? I hope not. The intention is not to do that. My intention is to remind you, though, how important compliance is. So sometimes I'll see students, they might come to me in June, not have done anything, not one thing in compliance, okay? For those students, we cannot help you, all right? Because it's too late to get compliant then. That's why I'm telling you, you need to start now, all right? Okay, go back to the PowerPoint. So, remember, have a look here. It'll tell you everything you need to know. All right, it tells you about immunisations. It'll give you a little thing that you need to download. That's your immunisation compliance requirement and certificate that you take to your doctor and get all of your immunisations noted on there. Okay? You also need to keep your blood results for all of your serology. So if you go to the doctor for chickenpox serology because the doctor's not sure if you're immune or not, you need to keep that blood result because a lot of the venues will ask to see those numbers. So they want to see your blood results. Okay, so keep all of that. Really important. Okay. It also tells you information about flu vaccine, CPR manual handling. It'll give you some providers that you can ring and contact about lessons, tell you a bit about uniform, lots of other information down there, okay? But your placement, so exciting and so important for your, linking those theory to practice, all of that stuff you've learned in the classroom, you're actually going to put into real practice on a real patient. So real people, not just mannequins, okay? So for some people, when you go on placement, you are scared out of your mind. But it doesn't take you long to recognise, yep, okay, this is for me and I really love it. So it's good. Right. PowerPoint.
Can you mention nails, earrings?
Yes. So when you go on placement, you can't have long nails, you can't have nail polish, you can't have even clear nail polish. The reason being is that it's an infection control issue. If you've got chips in your nail polish, bugs, germs collect under that and will potentially then cause infections in patients. And if you think about it also, you're working in the hospital and then you go home and you eat, you can't clean that properly, all right? Think about rings. You can only wear plain wedding rings, okay? You can't wear your pretty diamond ring that you want to show off because you just got engaged. For 2 reasons. Well, actually 3 reasons. So you might hurt someone, all right? Elderly patients and other patients can have really delicate skin. You can cause really nasty injuries with a ring, okay? They will damage a patient's skin quite badly. Second reason is I worked with a girl once who had her nice engagement ring on that she got the night before, and she lost the diamond out of it because it got caught on the side of the bed, okay? Third reason is you don't know what's going to get caught in your diamond, okay? So if you think about what nurses do, vomit, other bodily excretions, all get caught under your ring, in amongst all the little claws for the diamond. You don't want to be taking that home, all right? So no jewellery, no big earrings like this that patients can inadvertently pull. They might rip that out of your ear. No lanyards like this. Filled in leather non-slip shoes, okay? No sneakers, no runners, nothing like that. Because if you think about it, think about what you're doing. You're going to be showering people. Your feet are going to get wet. You might be carrying a bedpan and slip or trip. Bedpan sort of falls a little bit, that ends up on your feet. You don't want that going through to your sock, okay? So I've seen it all happen. So that's why I'm putting out the reminders now, okay? So you need leather, fully enclosed, waterproof, non-slip shoes, okay? Right, so we've talked a lot about compliance. So basically, long and short of it is if you don't meet compliance, you do not go to placement. Okay? Compliance is your responsibility. We can't help you with it. It's your job to get compliant. Okay? As it will be for your entire career as a nurse. Right, just let me check where we're at now. I think I've pretty much told you everything. Okay, good. So, resources to meet compliance. So, In Place, that's the site that you put on your Okta dashboard, that you upload all of your placement requirements to, so your compliance requirements. You'll find out where you're going on placement and who your facilitator is, okay? The placement website, we've just visited that, all right? Just Google that, really easy to find. Your vaccinations, go to your GP. You can go to the health centre on campus as well. If you're having any problems with meeting compliance at all, you go to the placements team, okay, like I said. Valerie Travers is the uniform people. Now, our uniform, you saw a picture of that before. They will be in room 312, level 3. They are setting up now as we speak. After I finish talking to you, I'm going to go down there and see how they're going with their setup. You will be able to try on uniforms and purchase uniforms today, yes. The scrub top, I think off the top of my head, around about 65 to 70.
Just the top?
Yep. And you need more than one, unless you're going to wash it every day. But if you're working a late, early shift, so if you do a late and finish at 10:30 at night and then start at 7 o'clock the next morning, there's no opportunity to wash that uniform, okay? And you have to think about infection control, all right? So if you're looking after potentially patients that have an infection or have something like that, you need to be able to wash your uniform every day, yes? You can get scrub pants wherever, as long as they are blue or black scrub pants. Valerie Travers do have scrub. You can purchase them there or purchase them from another uniform supplier. But you have to get the top through Valerie Travers. Okay?
I know
You
it seems like a
cannot-
lot of money, the $65, the horror look on your face up there, but you're going to have that uniform for 3 years,
Yeah.
and you will be required to have it.
Yep.
If you go to the intensive without your uniform, you will be sent home,
Yep.
and you cannot go on to placement without the uniform. So.
Yep. Yep.
Is there a vest as well? Are we able to wear that?
There is a winter vest, but you have to think about washing. If you're going to wear that vest, you need to wash that every day as well, because the vest is on the outside of your top. That's what's going to have the patient contact, okay? So, yes, washing that every day as well,
So
all
one
right?
of the rules also, sorry Jodie,
is that, and I get a lot of students who come to the labs in winter, I understand it's cold, with skivvies underneath their scrubs. When you're on placement, when you're in the lab, it is bare above the elbow, which means that if you have long sleeves, you pull them up, you have to have this exposed.
Yeah.
And it's the same as in industry. All right?
Yeah. Infection control is a massive thing in nursing. We all know what we went through in COVID. Okay, that taught us a lot of things, but it is a massive thing when you're working out there on placement. Okay, you can look after immunocompromised patients and getting them, if they get an infection, that can be really detrimental to their health care. Okay, yes.
Do we have to buy it now? Can we buy it closer to when everyone's placement's due, or is it shut?
Well, you have to have it for 1023, which is this semester. Okay, your best, what we say is your best to at least go there 6 weeks before you need it, just in case. And, oh, he's working still. And he hasn't got your size, and then he needs to order it in. Okay, so you need to give yourself a bit of a buffer. And they look really good. We've seen some uniforms up in the labs. They look very, very professional and really smart. Yeah. Okay. Key message, get organised, start now with your compliance, download that information tonight, have a look at that compliance, that Flinders University placement website. That's going to give you all of your information. Ask for help if you're unsure, okay? Always go to the placements team if you're unsure, all right? Don't ask each other because you won't know the answer. All right, don't rely on other students to get the right answers.
Don't rely on Facebook for your answer.
Don't rely on Facebook.
Honestly.
Or
please.
Google or AI or anything like that. Okay? All right, beautiful. Any other questions?
There has to be questions. I'm telling you that whenever we do orientation, everyone waits for me to hurry up and finish speaking so that they can listen to Jodie, and then we get half an hour of questions. Any questions about your placement? Where, when, how, what? Anything at all?
Are you excited about going on placement? Are you scared about going on placement? All of those things are normal, yes.
It's labelled as the Riverland. Whereabouts will you be placed?
So are you saying you're a Riverland student?
No.
Okay.
It's been labelled as Riverland on the placement.
Okay, I was just going to
Okay.
say, when it came up on there was 1027A, 1027B, 1027 Riverland. You cannot enrol into the Riverland. That is for our Renmark students only. There's only about 30 students, so if you do accidentally for any of your topics enroll into one that says Riverland, you will be pulled out of that, and then you're kind of like diminishing your chance of picking the best class. They are Riverland domiciled students only, yeah?
Yep.
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 Up the back?
Yep. Yes. Yep. No, if you've done it, that's fine. You don't need to do anything. We're just collating information now about students who might have an interest in going to aged care or mental health or prison. Yeah. So generally throughout your degree, you'll get an aged care placement, a community placement, a rural placement, and a specialty placement. We try and give everyone a specialty placement. That would be ED, ICU, operating theatre, something like that. Yep. Yep.
When do dates for placement get confirmed?
So you've got your timetable that you know when your placement will roughly be. Usually it's confirmed 4 to 6 weeks before your placement commencement date. Yep. I think I saw a question up here somewhere, no? Yes? And then I'll come to you. Yep.
This is more with classes. If we, for example, missed a class, would we be able to pop into the same subject but at another time?
Are you talking for theory or for intensive? Are you talking about a theory topic like, 1020 or something? If you miss a class, you need to speak to, or you're going to be away. And again, they're not compulsory, so I'm not going to get heavy there, but do come to class. You would contact the topic coordinator and say, look, actually, I've got a doctor's appointment on Wednesday. Is there another class I can go to? So it's sometimes about work health and safety. And, like if students come to me in my class, I'll say, yep, no worries, go to this class or this class. So, but it is one-off situations because when we have campuses like here or we have campuses at Bedford Park, our rooms are made to hold a certain amount of students. So I can't just have 20 students deciding to go into, someone else's class on that day. So, yep, contact the topic coordinator and it should not be an issue. Intensives, however, you have your 4 days, Monday, Tuesday, Wednesday, Thursday. That's it. That's your 4 days when you can do it, and that's the only week you've got to do it. All right, so if there's issues at this campus and you're sick for that time, then you will need to speak to the topic coordinator, who will probably come and speak to me, and we will have to find somewhere else for you to do it, as long as 1027 is still available. All right, so if you are sick, and I'm saying everyone gets sick, if you're sick and the only week that there is to do an intensive for 1027, you will not be able to do it, and you'll have to repeat the topic. All right, because we can't just put you on for the next week, because there may not be a next week. There might be a next week at Bedford Park, and we can shuffle things around if need be in one-off situations and accommodate that.
And intensive means?
That's your, no, intensive is your 4 days in the lab. So you're here at Bedford Park. You're here at Flinders City campus. You will have labs that they are making. I think it's across the hallway here. They're going to make them there. That's where you will do your clinical intensive. You will have a set week when you'll be scheduled to attend those intensives. Yeah?
Question here?
With placements, is there like a preference as to where you can go? Like, say you live in Glenelg, but you get put on placement in like Modbury, Golden Grove.
Yep. So that's the
You don't have a way of transportation.
Yep, that's the Clinical Placement Collaborative I talked about before, where the state government have decided that we will place students as close to home as possible. Okay. Sometimes still though, if you're in, say you live at, I don't know, Modbury, and we might put you in an area in Narlan, it still might take you time to get there if you don't drive. Okay. So if you're relying on public transport, sometimes that can be a little bit tricky.
And I'll just add to that before we go to back there. That doesn't mean that you, just because you say, oh, I live in, I don't know, near Flinders, means you're not going to say, oh, I can't do a rural placement because that's away from home. Jo, do you want to talk about what they learn on a rural placement, how valuable they are?
Rural placements are great. You will learn so much on a rural placement. So if you think about working in the RA in an orthopaedic ward, all you see is orthopaedic patients, hips, knees, shoulders, okay, that's all you see. But if you go to, I don't know, I'm going to say Cleve Hospital, you'll work in a ward, and in that ward you will have a 4-year-old that's fallen off a trampoline. You'll have a patient next door who's had a heart attack. You'll have someone else who's had a stroke. You might have a major MVA or a car accident come into ED and have to be retrieved out. So you see things like road retrievals, fixed wing retrievals and helicopter retrievals in the rural environment that you won't see when you're working in a metro environment, okay? So it's a really, really good experience, and you'll see lots of exciting stuff. And you can say to your facilitator, oh, I'm not on shift tomorrow, but if something interesting comes in, ring me and I'll come in, and I'll have another day off.
Nurses in the rural area are highly experienced. They have a lot of autonomy because sometimes it's just them sometimes. All right, so it's a great opportunity, especially if you're thinking down the track you want to do FIFO or that sort of nursing.
Really good opportunity. And as Danelle said, really highly skilled, because Danelle's ED nurse, I'm an ICU nurse. We've got doctors around us all the time. But if you're in a country environment, your doctor might be the GP. They're not there all the time. So if something happens with your patient and they deteriorate, you have to make a decision about what you're going to do. Okay, so really, really good experience. Yes?
So my question was like, with the collaborative,
Yes.
thing, like, say you live like closest to the Northern Health Network, does that mean most of your placements will only be in that area?
Correct.
Or do you have like a decision to like
Opt out.
You do, yes. So you do. So I mentioned that before. Your majority of your placements, if you say that you understand the Clinical Placement Collaborative and that you want to participate, most of your placements will be in that particular local health network. But you can always email the placement team and say, actually, I want a placement outside of that local health network for experience. Okay. Again, doesn't mean you won't get a rural placement, because everyone will get a rural placement. Yeah.
so you do like the 6-week topic and then you do your intensive like after you finished it?
Correct.
And then
Correct.
your placement is after that?
Correct.
Yep.
When you're done for the semester?
So-
Or do they come back?
Well, it depends on your. Let me just go back to, don't vomit anyone.
There.
So look at your bundle. Okay, so down here, red means we cannot move those placements. They are there. You can't just say I want to do my placement somewhere later or whatever. So these 4 here, is that my mouse moving?
Yep.
Okay. AO, those 4 weeks. There's 4 weeks of theory, for the placement topic. So you have 4 weeks of theory, giving you underpinning knowledge before you go into your intensive, right? So you do 4 weeks there, and then you'll get scheduled one of these 2 intensives. It'll depend, because there's a lot of students, we need to split you up. So you'll do 4 weeks theory, 1 week intensive, and then you'll be scheduled into one of these 2-week placement blocks. All right, you will know, how soon will they know that placement block?
4 to 6 weeks before.
Yep. So when you start that topic on week 1, you're likely to find out when your placement is.
So remember, in first year it's only a 2-week placement, but then in second year 4 weeks, third year 7 weeks.
And for those bundles, are you working during the mid-semester break? Because they go across the grade.
Yes.
Yes. Yeah.
As I said, only the very first 4 topics that you're about to do next week, they're the only ones that are in a semester. They are 12 weeks. After that, our nursing is over the January to December. There will be breaks. We don't make you work entirely the whole time. There will be breaks. That's why you see when you get your bundles, it won't look like this necessarily, but that's how you can map it out over the year. You can see where you've got breaks and where you should take some leave.
Now, you mentioned a good word, working, and I haven't actually mentioned that. When you're on placement, you cannot work, okay? Your placements are full-time, so you have to stop doing your other work, all right? Now, you've got plenty of notice. It's now February. Your placement is not until maybe September, October. So you've got time to set up a separate bank account to put some money aside every week, and that's your placement bank account. So when you're on placement, you have money there ready to go, okay? So you cannot work when you're on placement, because full-time placement and then you work on top of that, it puts you at risk of getting tired, you make mistakes, that then puts your patients at risk and the venue at risk.
And work health and safety, we won't be covered legally if you're doing things like that.
Yep. Okay. Any other questions? Yes.
Yeah, as for the compliance for placement.
Yes.
Yeah, so I got onto InPlace and upload some documents there. So what if I finish all of it, and like how long does it take for the team to validate it?
Well, your compliance date isn't until July, so they will be working on other topics before that who have an earlier compliance date. But if you upload it and you want the team to check it, just send them an email to placements and they will check it for you. Okay?
And one more about the vaccinations. Like we have like Hep B
Yes.
and Hep A. So do I really have to get the Hep A?
The Hep A is usually only if you're going to go to the Northern Territory and some remote locations.
So yeah, and I already have the second dose of Hep B. So do I need to do the blood test?
So you need 3 doses of Hep B and then a blood test.
So like do not think like if I have the second dose.
So if you've had 2 doses, you need to go back to your GP and get a 3rd dose and then have a blood test done.
Yeah, but I still need to wait for a while. Like
Yep.
Away from the first dose.
Yep. You need to go to the GP for that. Okay, they'll decide your injection plan. Yep.
That's why you need to start early, because
Yep.
it's a Hep B that takes months because you have to
Yep.
wait, and then you have another blood test and
Yep.
you wait, okay? So that's why
Yep.
you need to start your compliance early.
Yep.
So as Jodie was saying, with the deadline as to July is when they'll start, they'll look at it sometime in the lead up to that. Like currently we've got our 3rd years doing their intensive this week. They're going on placement next week. So they're busy with those ones at the moment. Then the 2nd years start next week or the week after, and your 1st year placement's at the end of the year. So they work on all of the 5 PEP topics. So if you can get your compliance done early, that's great, but you may not receive notification back just because you've uploaded things really quickly.
Yep.
Which we love that you upload it quickly. That's great.
Yep. Yep.
Up the back there,
Yep.
you had a question?
I work at Flinders. If I was doing my placements at Flinders as well, I wouldn't be able to work at the same time.
Correct. No. And we would need to look at what you do there. So if you worked somewhere as an EN, we might not send you there as an RN or student RN, okay? Because there's there's different expectations of when you're there as an EN one day and then you rock up the next day as a student. They're expecting you to be able to do things that you can't do. All right, and it just puts you and the staff in a difficult situation. So if you're in that situation, send us an email. Okay? Yep.
The same as those that are AINs as well.
Yes.
So when you go
Yep.
onto the ward, we're not going to place you on that ward because people will see you and they go, oh, Mary, come over here and help us
Yep.
with this,
Yep.
which is what you would do as an AIN. But
Yep.
you're there as a student registered nurse to be doing things in that scope. So we would avoid, where possible, placing you there.
Yep.
If you do get rural placements, and you said about accommodation, you might have to get it yourself. Would the university tell you
where is best to
Yes.
go if you did have to?
If you get allocated a rural placement, the placement team will send you a whole heap of information about the accommodation in the area, lots and lots of information.
And then like how you can be eligible for payments over placement, is there anything to help pay for accommodation if you did have to?
Well, your CPP, you're getting paid for that. Okay, so that would help you pay for that accommodation. There is some reimbursement at the end of your placement for accommodation and for fuel and that sort of thing. You can go to the website for more information about that. Yes, just domestic students.
Like your rosters
No.
of your
So
placement?
the placement team won't do that, but the venue will. So either your facilitator or the venue will email you your roster, or you might get your roster on the first day.
And it is not appropriate to contact the venue and say, I can only work mornings this week and I only want to do lates here. You need to get what you're given, okay, because you are starting out. You want to make the best impression. Every placement you go to is a job interview and is how you should be viewing it. If you go there and start making demands and say, oh, look, I'm going to be late tomorrow, sorry about that, or I have to leave early today, that's not what happens in nursing.
Doesn't
because
work.
the next nurse can't come on until they've high-fived, got the handover, and then they're out the door.
Yep.
So make sure you be respectful with things like that as well.
It's about professionalism, okay? You're practicing to be an RN. You need to demonstrate that professionalism. Yep.
What about the placement part? In the website, do they tell which vaccination you must take?
It does. It tells you every single vaccination you will need, so you need to download that vaccination or the immunisation compliance certificate, take it to your GP and work through that with your GP.
Because some of the vaccination you got to take first.
Yes, correct. So your doctor will work out that with you. Okay? Any other questions?
Say that again, sorry. No, so you might have come in late. So just asking if the enrolled nurses start with a 2-week placement. So the enrolled nurse is coming to the second year. So I give you credit for the 2-week placement because you've done stuff at TAFE and your EN. So ENs will come into second year. The first placement that they will do is 2022, which will be in about about 6 weeks' time. I think they
About
start
April.
going out onto their
Yeah.
placements. That's when they start. So they go straight into their 4-week placement. Yeah? Okay.
All right. Anything else before I hand back to Danelle and I will go and check on the uniform people and make sure they're all ready to go? Yes. Yes, you can. But you might want to try it on first so you know the size. Okay? So I would recommend going down there today, trying it on, and then you know the size, but you can order it through him as well. Okay? All right. Excellent. I'll leave
Jodie
you
will
with
come
Danelle.
back for questions at the end, so I'll try and smash out the next bit really fast, and we'll go from there. So the next bit really is about resources and help. You met, or those, some people were not here, so the Student Success and Wellbeing Advisor was Melissa Suckley. She talked a bit earlier, and that slide might have come up on Tori's presentation. So this is just someone who is a professional staff member, not an academic. So sometimes we will refer students to the professional staff member because there's less fear or whatever than talking to your topic coordinator about something, for example, and they can talk to a professional staff member where, there's no impact on you. Well, there's no impact on your grade anyway. So they're someone who would connect you up with services and has time, and that's what they do. In saying that, if a student comes to me and they have an issue, I will also refer you to services as well. All right, so I'm only going to quickly go through these slides. Some of these were spoken to at the very beginning. Student Learning Support Service, you should have all this on your dashboard on Flow. I'm going to say please, please, please look at it for help. Sometimes students coming straight from school, sometimes coming from overseas or having a break between when you study, you might lose some of that academic background and think you're writing fantastically, and then you get a fail back on your first assignment and it's devastating. So make sure you utilise the Student Learning Support Service. They are there to help you how to write essays, how to write reports, how to do all sorts of things, and they're really, really helpful. I put these little pictures down here. One's got APA referencing. I'll badger on about referencing for a whole session, but I won't. Referencing in
nursing in academia is really important, and it will relate to my next slide, hopefully, if I've got them in order. So things like that are really important that you learn how to do, okay? It's not just, oh yeah, I forgot to put the reference on, because that becomes an issue, all right? I think my next slide will talk to that. This one I could talk all day about, okay? Because I see a lot of this stuff in my topic and also as the course coordinator I have to deal with. Academic integrity, so this is about your academic writing, and that refers back to referencing, it refers to researching and all that sort of stuff, because for every assignment that you pretty much do, almost every assignment, you'll be required to do some research to find an answer, all right? And putting google.com as a reference is a no-no. Google is not your source of information. I cannot stress that enough. Artificial intelligence is not your source of information, okay? If you come into my topic and use artificial intelligence, it's very sad for you, okay? But I tell you all that up front, all right? Artificial intelligence is really bad in nursing. At no point are you going to be able to step out of that ward to go, oh, dear ChatGTP, are these symptoms a heart attack? Should I be doing CPR? I should. Okay, quick, and run back in. You have to know this stuff. Artificial intelligence is great in marketing and those sort of things. In nursing, I graduate you on the basis that you know your stuff and that you're going to go and look after someone autonomously, make decisions autonomously based on your knowledge, okay? Cheating to get through university might get you through university, but it'll get you losing your registration in your first year out when you don't know your stuff and you do something dangerous. So academic integrity is about doing things with integrity, and I'm talking about your academic work. So when you're out there researching and you're looking in journals or you're looking in your textbook and you find the answer, you then put it in your own words and then you write where you found your answer. Now, we teach you this in this first year, but it is important that you understand that you have to reference where you found your information, because it's not your information. Someone else has done the research and found this for you, so you have to reference that all the time. So you will learn about that. It's really important, again, with bad things like artificial intelligence, that sometimes references are hallucinated. So I'll go and open up, when I'm marking, I'll open up every one of your references and I'll check, what have you said? Oh, you've said this. Oh, this document doesn't say this. Then you'll get called into the topic coordinator's office to have a discussion with them, because that is misrepresentation, it's misconduct. All right, so what happens at university, I don't want to scare you, but I want you to be informed about it, okay? So not referencing is plagiarism. So you'll get a warning from your topic coordinator and they might say, this is wrong, let me educate you, go fix it, and I'll let you resubmit for full marks. But you'll be expected to fix it, to go through that learning process. If you do something where you write a whole bunch of stuff that Google told you, and then you just put random references there, you'll get called in and we'll say, this is not the done thing. This is misrepresentation. I actually have to send this to an academic integrity officer. All right? They will then make a time to see you. They will then educate you, and they may say, you know what, you can resubmit, but you only get 50%. That's the maximum grade that you can have. So that's a penalty. If you do it more than once, they might say, you're going to get 0 for this assessment. So it does impact your studies, okay? It impacts your progress in the degree as well. So, you know, you don't want to get a 0 for a 40% assignment, because it's really hard to pass a topic when you get something like that. So I don't want to scare you. What I want to do is inform you. And again, I sent out an email on the BN page a couple of weeks ago about falsifying documentation. That also comes under academic integrity. So students who falsify whatever, make up a pretend medical certificate or change the date on a medical certificate, I will automatically send up the hill. And when I say up the hill, that's a visual, I send it up to an academic integrity officer. You will get academic misconduct and a 0 for that assignment that you put that in for. If you do it more than once, because you get a record then, like on the cloud, academic integrity record, if you do that more than once, then you'll get 0 for the topic for something. So it's really important as a nurse that you have integrity and that you do things the right way. It's really important when you're doing your nursing studies that you know your stuff. You don't have to know 100%. You don't have to be a high distinction student. You have to know a 50% safe amount, because when you go on placements, you start to build all that knowledge. All right? I just need you to get through this course ethically and with a 50% safe pass. All right? Any questions about the scary stuff? You will we will talk about academic integrity in most of the first year topics to get you used to it. Some of the first year topics will take you through ChatGTP or Copilot, I think we use. Do not use ChatGTP. We'll take you through that to teach you something, but you need to make sure you look at every assessment of your topics that you do, and if they say no academic or no artificial intelligence tools are allowed in this topic, that means you cannot use them. And we see so much of it that I can read someone's paper and know that it's been generated from a tool. I can just read it because we know the tone, we see it. All right? And then I have to bring students in and they get all sad and they say, no, I didn't. I did all the research myself. And then we talk further and I ask them to explain the concepts and they can't do that, which means they didn't do the research themselves because they don't know. They couldn't explain it at all to me. So it's really important in nursing. You're going to have someone's life in your hands with some of the decisions that you make. So it's good that you know your stuff. Really important that you know your stuff. And you don't have to know everything because you will learn stuff. Nursing is a team sport, so you will always ask questions of people anyway. Library. I've missed my place in here, so I'll just ignore my notes. Library, so you will have a library here. Just because you're enrolled here doesn't mean you can't go to Bedford campus. If you happen to be up that way and you want to pop into the library, you should still be able to use your card and everything up there. So your library is very important, and you can always go onto the library site. I always say to students, it's actually one of the shortcuts on my bar, because whenever students come in to see me, I teach them how to use the library, how to search for journals, type in Flinders Library and save it on your tab as well as a favourite. Oasis doesn't really apply to, it's only upstairs. Flinders University, so this is the FUSA. I think they're downstairs giving freebies away. I think you should be all getting some freebies of some sort. FUSA, Flinders University Student Association. Tori talked about it earlier at the very beginning of the session at 9. They are there for you. Okay, so sometimes I get students who come in to see me and, they've fearful, going to the course coordinator because I'm so scary, and they bring someone with them, and that's okay. They can bring someone with them. So if you feel that you have to go and see a topic coordinator or even an academic integrity officer, and you're a little bit fearful or you're a bit frightened about, you're a bit worried, you can speak to FUSA and you can have a FUSA representative come with you. They basically just sit with you and they advocate for you if you need to, if you're too nervous to talk or whatever the situation is. So they're there for that. They do. They have contacts for emergency accommodation for like domestic abuse. They have all sorts of stuff. So it's really well worth going through their site to have a look. I think they list scholarships on there as well, and lots of things. So it's run a lot. I think there's a lot of students involved in there, but they're all about your rights. And as course coordinator, I encourage you to go and find out what all your rights are with FUSA. All right, and they always come to all these events and give you lots of freebies, so they're always good to know too. Health and counselling and disability services. So I don't know if they talked about that. Yeah, they did talk about it. There's a counsellor on premises here. So now you don't need to suffer from anxiety or suffer from anything to go and see a counsellor. Often you get those, remember I talked about the peak moments of stress when you've got lots of assignments due and things like that. The counsellors will see students who have bouts of anxiety, I suppose, because of these peak moments of stress. They understand academic stress. Okay, so you don't need to be a stressful person. You might just have a period of stress where you need to talk to someone about it. And these are great people to make appointments to see and talk to, and they can help you with coping mechanisms because they see students all the time across the whole college, not just nursing. Other things with this is access plans. They used to be called disability access plans, but they're just access plans. So for medical conditions, say someone's got, type 1 diabetes, for example. So yes, it's a medical condition, that's fine, that's great, doesn't mean you can't be a nurse, but you might need to have something on your plan for when you go on placement that says, may need to check sugars at certain times. Also, mental health conditions. If someone suffers from, I don't know, let me think. Oh, I won't go with that. You know, say someone has a medical health condition or a mental health condition which impacts them being able to study, you know, they've shut down or whatever, you might be able to get a letter from your GP or your specialist to support that you might need an extra 10 minutes for a quiz or something like that. There's not like, you don't get like huge allowances, but it's just about equity. I've had a student who was a single mum with 2 disabled children, for example, so she found it very hard to juggle things. So she had a talk with these people and put something in place so that if she needed an extension on her assessment, she didn't need to go to a doctor every time. However, she was given 4 days as an extension automatically with the Access Plan once. Okay, it's not every time. Something to remember and to think about when you're applying for your access plans and things like that, if you do have medical conditions or mental health conditions or learning difficulties. So learning difficulties, things like dyslexia. So someone might need, if they're doing an examination, they might need an extra 10 minutes. No one's ever given like half an hour, you just get an extra 10 minutes or something like that. So just for things like that. But one thing to think about is with nursing, there's inherent requirements. There are inherent requirements through AHPRA that you have to be able to do certain things. All right? So if someone, for example, if someone was profoundly deaf, they couldn't do this course because you can't hear emergency bells, you can't hear someone yelling, you can't hear instructions. It would be just impossible to be a nurse if you were profoundly deaf, for example. That's an extreme example. But when you're thinking, if you feel that you have, and you can talk to me about it later, if you feel that you might meet some of these criteria or you might meet criteria where you need allowances to be made for you, have a think about what that allowance is. And on the Nursing Flinders page at the very bottom, there is a thing about inherent requirements. So they are, you must be able to read, write, calculate, communicate, and all those sort of things that we all sort of take for granted. So remember that they are the inherent requirements of nursing that regardless of if you're enrolled in here, if you don't meet them, at the end of the day, you won't be able to get registered with AHPRA. Not to be scary, just to inform you, okay? Because that's the sort of, you want someone looking after you who is able to. International students. So I don't have someone here today. At Bedford Park, I have someone coming to talk. But basically, we have a great team of international support who look after international students. Things like visas, complications, you know, if a student happens to be unsuccessful at a topic and it impacts visas and stuff like that. These are the people who you should be talking to. I'm just going to go on to the next page, I think, which has frequently asked questions while I'm waffling on. So there's a lot of requirements with international students in that you can only do so many or so much online topics, and then you actually have to be here for the rest of them. There are things like you cannot be away overseas, for example, in your country, while you are in topic, because you will get withdrawn from that topic, just taken out, and then that comes off, and then you're under load. All right, so there's quite a lot of things that you need to be aware of. If you are an international student, the international student services team will have reached out to you, and they will reach out to you for support to help in any way. They also organise events as well for, I know that we had I think it was a Christmas event down at the cafeteria at Bedford Park, but I'm sure someone here will organise something just to make sure that you guys are still, you know, meeting together as a community and integrating and assisting you where they can there. All right, so they have iss@flinders.edu.au, but they will reach out to you. Yungarinthi is for Aboriginal and Torres Strait Islander students. It's just a support network. I believe that there is now a student space here at, I've got FMC, but I mean FCC, so the Flinders City campus here. But they're also available through, you can phone them if you need to, or they have an email address, so for specific support, tutoring and that sort of stuff. So we have other options available for our Aboriginal and Torres Strait Islander students as well. We've all seen this page because I can see that we're nearing the end of everything now about Flinders, and that's about making sure that you get onto your flow site as fast as you can, have a look, familiarise yourself with it and everything that you need to do. Again, There's an email at the bottom, and I think as a student you'll be receiving lots of emails in the next week or so about O Week. I'm not going to go through all this because this will be on all the slides that Tori went through. Some of these things are here. I understand scavenger hunts and stuff are here, and there'll be lots of boards around advertising stuff in O Week, and then Connect Week is also when they're doing other things as well, just to make sure that students are meeting, sort of developing those community and networks that you need to be doing. So this is your college. I think you would have done this before for the last session as well. This is a session for the Bachelor of Nursing. Now I've put this here, BNGU, which is most of you guys. BNGG will not be students here. These are our grad entries, so that won't be you. And the UCs are our enrolled nurse. So you can go into a prize to win $250, so you're welcome to do that. Is there any questions about absolutely anything to do with nursing? Topics, timing, terms, teachers, oh, T's there. Anything at all. I want you to feel comfortable that you know what's going on. Yep.
So with some topics, some have already been like taken for the second semester. Can I go to Bedford Park, or do I have to?
Are you Flinders? So what do you mean they're already taken?
Like people have already registered and there's not enough spots available here.
There should be. What topic is this for?
Obituary.
Yeah, there should be spaces available. So if we have, let's just say we have 100 students who are enrolled in FCC, we should have capacity for 100 students to enrol into classes in FCC. So that it would be expected, like for your convenience, you've enrolled in the FCC location, you would be expected that classes are here. Yep. Yes, I'm doing one tomorrow from 9 until 12. It'll be a rinse and repeat. Hello?
I'm enrolled into my semester 1 topics and lessons.
Yes?
Should I be enrolled into my semester 2 lessons?
If they're available, absolutely. Absolutely. Yep, you should enrol. That way you can plan your year. You can pick your classes, get in there early. Don't miss out on the classes that you want. Yep. Questions? Work backwards, not fall over. Any questions over this side? Placements, university, studying, academic integrity, enrolments, textbooks. You should have a look on your site. There should be on your site your textbooks that are required. We try to use as many ebooks as possible. The only thing with ebooks is sometimes there is a limited license. So, you know, they might have only, say, 10 people per time available on an e-thing. There are some books I recommend that you would get that you might use over 2 to 3 years. So the ones in the patho topic, for example, med-surg, there's a set of 3. I think they're used in first, second and third year. Definitely second and third year they are used, so it's a good investment. The Facebook sites for Flinders Nursing often has the students who are leaving selling their books, and so you can pick up cheap books as well. You know, some people study better by highlighting and vandalising their books. You know, I do, so I have to buy my own, so I don't vandalise the library books. Some people
is there a requirement
to.
for the topics that we need to have?
There will be, for a lot of the topics, there will be a set text, which means a lot of our work and readings will come out of the set text. So it'll prompt, you will require that. Okay, or you'll be required to read it. So I remembered what I was going to talk to you about. The flipped classroom is how we do all of our lessons. So like I said, no one lectures you, but we do flipped classroom. So what happens there is that you are expected to prep for 6 to 10 hours beforehand. So maybe you're doing module 1 this week. So you need to read your module, and in your module it'll say, read chapter 13, blah, blah, blah. So you've got to go to your book and read chapter 13. There might be some activities for you to do to get you thinking about it. So flipped classroom is you do work before you come to class, not half an hour before, but hours. You need hours of work to do. Then you come to class, because when we design our lessons, we design it on the basis that you have some idea of what we're talking about. So we will design group work or activities where you are consolidating the knowledge, because we only see you for 2 hours that week, or 3 hours depending on the class. We can't deliver a whole module of work to you in 3 hours. We will deliver or facilitate your learning of what you have done. So that is what flipped classroom is, and that's what we do at Flinders. So don't just say, oh, I've only got to go to class twice this week for 2 hours each. That's cool, I can go to the beach or I can go and do that. It's not like that. If you are enrolled full-time, it would be expected that you are studying Monday to Friday full-time. So if you're not in class, if you've got classes on Tuesdays and Thursdays, on Mondays and Wednesdays, it would be expected, I would be expecting that you would be doing your prep, writing your notes, getting yourself ready for your session on the Tuesday and the Thursday. That's what I would expect you to be doing, because it's not just 2 hours a week. If you are studying full-time, then it's like a full-time job. At some point, if you're sitting there going, oh, I've only done like half a day's work this week, this is terrific, then you're doing something wrong. You should be doing all your background study for each module before you go into tutorial 1 where you do your module work. Does that make sense? Oh, it's exciting, I'm telling you. It'll be exciting. It'll take you, you know, that first semester, get some of this exciting nursey stuff when you're doing anatomy and physiology and health assessment under your belt. But once you get that first placement done, honestly, you'll feel much more excited about your nursing, because I'm looking and you're going, oh my God, oh my God, oh my God. If you are organised and you follow what the tutor says, you follow what your topic coordinator says, you be a good student and you make sure you come to class as much as you can, you will be fine and you will love it. Doors will open for you. There is going to be so many jobs in nursing, all right? And I'm going to say this, you're not going to want to believe it at the moment, but you're going to do more than 3 years of study, because you're going to get to the end of this, you're going to go and work on the renal ward, you're going to love it, and you're going to go, I'm going to do some postgrad studies here, and then you're going to go and do your graduate certificate or your graduate diploma. Then you might get really excited and go and do your masters, all right? So you'll do all these things, and every time you do a little bit of education, more doors will open for you, all right? So you've got years ahead of you to decide what you want to do, pace yourself. It'll be very exciting. Questions? More questions? Come on. Like I said, I'm doing another session tomorrow at Bedford Park, 9 until 12. Much of the same stuff, but more Bedford Park focused. And then again, I'm doing it again on Thursday as well for our graduate entries. So, and they will be uploaded. I don't know about the recordings for this. I imagine they'll be uploaded, but I'll certainly be uploading those recordings onto the BM page if you've missed any information. Last chance. Going.
Might sound silly, but what's a workbook as an assignment?
What is a workbook as an assignment? Well, it can be all sorts of things. I have a workbook in my topic, for example. So a workbook might be a selection of questions that require, say, paragraph answers. Or it might be, so I think Anatomy and Physiology has a workbook. Am I right? Yes, they do. And that, I recall, is questions and answers. Sometimes it might be an image that you have to label. It might be, so mine, for example, I have 6 or 7 mini case studies, 3 or 4 sentences, and I expect a paragraph answer. So it's not an essay where you have a beginning, a middle and an end. It's just a sort of question and answer type thing. Okay. Yeah. So you'll get assignments, you'll get reports, there'll be oral videos where you might have to record something on your phone to MP4 format, and that has to be uploaded. You might have to do a PowerPoint with you standing in front talking to it type thing. Lots of different variety of assessments that you'll get.
With the textbooks and stuff, if we go into our Canvas and we go to the topic, will it, the actual specific subject, will it have the specific textbook for that subject there?
Yes, it should have. There's someone. It'll either be on the page that the topic coordinator has done their welcome on, or there should be a textbook thing on the side of your required textbook or recommended textbook. I think in first year a lot of that is the what's those first 3 foundations of fundamentals of care or something. They underpin a lot of topics that we use, but again, they're also available secondhand from a lot. And you know what? If it's the most recent 2025 copy, or you won't have a 2026, they might be very expensive. Not to say that you can't use the previous edition, just the page numbers might not be the same for the chapters. They don't change that much. Like your anatomy and physiology book, like the bones and the muscle, they don't change. The body doesn't suddenly change. So if you can find an equivalent, for example, for your anatomy and physiology book, if you can't get hold of, I don't know what book, is it Martinez or whoever it is this year, if you can't get that, AMP is AMP, all right? But, MedSurg, where we have a specific book, I would do that. Any more questions? No stupid questions. There is no such thing as a stupid question. If you don't know, I don't want you walking away going, oh, I should have asked her. Otherwise, I will close the session now, and if you want to come and ask me separately, you can also do that.
Sorry, one more.
I love it. One more.
Placement stuff from
Yes.
the government, like for health, they were saying that all nurses students get paid to do placement.
No, not all nursing students get paid, so that's a very new thing, let me tell you. That's the Commonwealth PRAC payment, and you have to meet eligibility. So there's quite a lot of eligibility, you know, you can only work this many hours and earn this much income and blah, blah, blah for a certain time in the lead up. And I think it's something like 319 a week or something like that.
Yeah, I can't remember off the top of our head.
Yeah.
We actually have nothing to do with that. There's a specific area in the university that manages all the CPP payments, but yeah, you do have to meet really strict criteria.
But it's a Commonwealth funded initiative. So we are only letting you know that this is available. Yeah, some of those things through there. You know,
if you Google it, you'll find out information. Just even go to the Flinders page and put in CPP and you'll find information.
But it's not like a common thing that everyone just gets.
No, everyone doesn't get it, no.
Absolutely
no.
no.
Gosh.
Unfortunately, no.
I mean, it's only new, only started, I think, in July last year.
Yeah,
you know, in all the years that I did nursing, it was no. So, you know, and unfortunately, it isn't available to international students because it's Commonwealth funded. So, you know, some things that I recommend, you know, it is expensive when you're doing nursing, when you're not allowed to work. And I know that some people need to work, everyone needs to eat. So that's very important. But don't risk working while you're on placement, because you will get withdrawn from placement and you'll get withdrawn and you don't get a second chance. It is a fail for the topic and then you have to redo it. All right? So ideas about, like Jodie mentioned, about saving money, putting a little bit of money away for when you actually do your placements is really ideal to be doing that. You know, your placement's not till the end of the year. I personally would be like filtering a little bit of money aside each week where you can, so you have your placement fund, money that you can rely on when you are on placement. It does get, you know, a bit more dire in third year when you have those 2 7-week placements. But then again, you've all signed up to do nursing. We've been very open and transparent about the requirements that you need. So sometimes it's that sacrifice for those 3 years, and I guarantee you we've all been there and we've all done that. Yeah. All right, we're going to end the session. If you have any questions for Jodie or myself, we will hang around for a little bit. Otherwise, yes. Oh, questions. Yeah, about to leave another question. No, you don't get to self-select placements. If you have an overwhelming desire to work in oncology or something due to whatever reason, you can approach the placements and say, I'd really like an oncology placement. If you have relatives who live in Strath, Mount Barker, Yankalilla, or those regional areas, for example, you can say, I wouldn't mind going to Ceduna because I've got relatives there, so there's your accommodation done, and they can try and accommodate you there, absolutely.
Yeah, there is also a rural self-select process that will come out each semester. So if you've got a placement for 1027, for example, that will come out towards the end of semester 1, beginning of semester 2, and you can opt to go to a rural environment for your 2-week placement. No, this will go out to you as a student, okay, from the placements team. But if you want to go somewhere, you can email that email address and say, I have an interest in this, and they'll include me in the email and we'll say, yep, thanks, we've noted that, but we can't guarantee anything. Yeah.
All right, don't forget, uniform room downstairs, 312. If you're not buying it straight away, at least get your size right so that you can order it online.
All right? I've been down there, he's got lots of uniforms there.
Good.
Ready to roll.
All right, thanks everyone. I'll just turn this off.